Hello and welcome. You're watching Fine Print. I'm Bhairavi Singh. First up on the show, well, the coronavirus pandemic is wreaking havoc on humanity, and what makes it worse is that it is no longer contained just to China, with infections being reported all over the world. And now, in the latest from the UK, at least 51 confirmed cases of the virus have been reported in the country. Now, taking stock of the situation, the British Prime Minister Boris Johnson held a press conference along with Britain's Chief Medical Officer, Professor Chris Whitty. The Prime Minister Johnson said that there could be a very significant expansion of the number of cases in the country. The British government warned that at least 1/5 of the UK workforce could be absent from work at the peak of the epidemic. The Prime Minister also assured that his government will review the country's statutory sick pay policy and assess the risks posed to Britain's workforce. He also said that a reasonable worst-case scenario would see almost 80% of the UK population contract the virus. Listen in.
On the issue of statutory sick pay and the risks that the workforce could conceivably run in that worst case, reasonable worst case scenario that you described, we're going to keep all options under review, but we're well aware of the issue.
All right, to talk a little bit more about what's happening in the UK, we are now joined by our WION correspondent Anila Chaudhary, joining us live from London. Anila, thanks very much for talking to us this evening. Now, Boris Johnson saying that a reasonable worst-case scenario would see almost 80% of the UK population contract the virus. That's a very, very worrying figure there. How's the government come to this number, and what are they expecting to do about it?
Well, it seems the government is still taking a kind of a non-fearful approach. They have got two different scenarios. They have prepared for a worst-case scenario, in which case we would see school closures. There have already been 2 schools that have closed because of the coronavirus, and it seems they are taking that line, and they could see a ban and restriction on public gatherings. It seems also that they're saying that 1/5 of staff could be absent from the workforce. So they are urging businesses to take care of staff welfare. And that doesn't just mean health. It also has financial implications, which they are saying is under review when it comes to statutory sick pay, because, of course, you have to be in confinement for 2 weeks. So they are saying that's under review, and it seems a lot more proposals will come out. But they do seem to be preparing for a worst-case scenario. They're also saying that when it comes to the NHS, there might be such a shortage of staff on the NHS that they're going to have to call in retirees and leavers to cover those staff that are sick. They're also saying that if there are too many police officers off of the streets due to coronavirus sickness, they're going to have to call in the army. But before that kind of worst case scenario, there is very much that sentiment too from the Prime Minister Boris Johnson that there has to be a bit of self-care and self-reliance, that the public need to wash their hands. And Jacob Rees-Mogg, one of the MPs, said yesterday that that will be the national anthem, that wash your hands. So it seems that the government is saying that you need to take some responsibility for yourself in this first instance, before the inevitability, which they've said it is an inevitability, that the outbreak will spread. And of course, you know, we're seeing those numbers that you're talking about, that 80% who could possibly contract it. And in that case, they are saying that they will take care of the most vulnerable and sick. But they're also saying that the public have to accept that they will have to self-confine. So that's taking care of their own containment for those 2 weeks that they are saying you need to stay at home for 2 weeks for.
Right, right. Anila, thanks very much indeed for joining us with the latest on what the government is planning to do in both worst-case scenario and if it doesn't affect so many people, but still, of course, impacts a lot of other people in the UK.